Hello, you are watching Discussing Fitchburg Now with Sam Squailia. I am with Jason Lefferts, the Director of Communications for the Massachusetts Health Connector. Thanks for coming on, Jason.
Sam, thanks for having me. Really
All right, so we're going to talk about the Massachusetts Health Connector, which is our connection to health insurance.
Sure. So we're sort of Obamacare for Massachusetts. We were around before Obamacare.
Romneycare.
We were once Romneycare, now we're Obamacare. Most people get their health insurance from work, whether it's directly from their work or maybe they're married to somebody who gets it from their work. But there are people who don't. Maybe they just moved to Massachusetts. Maybe they run their own company. They're by themselves consulting or trying to start a business on their own. And they need health insurance from somewhere. So they can come to us. They can get help signing up for health insurance. We also provide financial assistance for people who are lower income. And our Connector Care program provides lower premiums for some people at $0 premiums, low co-pays, usually 10 or 20 bucks, depending on what you're going to the doctor or the hospital for, and no deductible, which obviously for people who have health insurance know that is a big deal.
So this program is not necessarily for people that already have insurance through their workplace.
It can be. If you pay a lot for your health insurance from work, you might qualify for a Health Connector plan. But most of the people in Health Connector coverage don't have that option.
Mm-hmm. So if you currently don't have health insurance, or if you currently have health insurance but maybe you feel like your coverage is a little low, or your payments are a little too high,
right,
then it's worth looking at the Massachusetts Health Connector.
Yes, if you already have insurance and you're paying, if your premium is more than 10% of your salary, you can get into a Health Connector plan. If you don't have health insurance, yes, you should come see us, because a lot of people don't realize the Connector Care program exists. They just hear health insurance and say, there's no way I can afford it, and they don't know that there's options there that can make it affordable.
So how does the Massachusetts Health Connector work?
Sure. So we have 9 carriers. We have 55, 60 plans. It's broken down a little bit by region. You wouldn't see all 55 plans here in Fitchburg, but you can go online, you fill out an application. The system will tell you immediately, maybe you qualify for Mass Health, and that's a completely different conversation that you have with Mass Health. You're all set. Or you qualify for Health Connector coverage. Some people... And
that would tell you when you're going through the process?
As soon as you're done, you press the button, it tells you which way you go. If you're getting Health Connector coverage, some people, they don't get that subsidy, they don't get that help paying for their coverage. They're paying sort of open market prices. For other people in Connector Care, they're going to get a list of 3 to 5 plans typically that are available, how much you're going to pay for that plan. You pick it, you get a bill, you pay it, and you're done. You have to pay by the 23rd of the month to start coverage the next month. That's an important detail.
And so there's an enrollment period,
yes,
for the Health Connector. And how does that work?
Yep, sure. So we are not in that open period right now. Some people can get into coverage, right? If you move to Massachusetts tomorrow, you can sign up. If you do qualify for Connector Care, you can sign up now. Open enrollment starts November 1st, runs through January 23rd. Anybody who needs coverage can come in then and sign up, no matter what their situation is. So that's the time when we're really very aggressive in terms of visibility, encouraging people to sign up. We're at over 97% coverage in Massachusetts. We're like 2.8%, somewhere in there. We're talking less than 200,000 people. We're trying to find them and get them to sign up.
Mm-hmm. So why is there a period for open enrollment?
So it's sort of an insurance technicality. Insurance companies don't want you coming in just when you need health insurance, because that means they're paying a lot for your services, and they have to spread that out through all of their members, and it increases everybody's premium.
Because it's a for-profit industry.
Right. Well, no, there are a lot of great nonprofit carriers in Massachusetts. But we also want people to have health insurance all the time, because you never know when you're going to get sick or hurt, and you're going to need to go to the doctor. And it just, not only is it less expensive when you have health insurance, it also encourages you to go to the doctor. It makes it obviously easier to go and get an appointment and pay for, a copay is a lot cheaper than having to pay the full bill if you break your arm, for example. So we think, people should have health insurance all the time. It's important health-wise and financially.
So what about those people who feel like they have no money anyway? What's the point of getting insurance anyway?
Sure. You never know what's going to happen, and there might be an option affordable for you. We might have something that fits your needs and your budget, and the only way to find out is to get on and apply.
Are there penalties if you do not have health insurance in Massachusetts?
So there's still a state penalty in Massachusetts. We still have our individual mandate in place. It ranges depending on your income level, but it can be up over close to $1,500 for the year if you went a whole year without health insurance. So yeah, we want people to get covered and stay covered, and we still have a penalty in place.
So of the people that aren't currently covered in Massachusetts, why have you done a demographic of why aren't they covered?
Yeah,
why aren't they seeking health
sure.
insurance?
I think one of the things we're lucky to have here is we do have some really good information and data on who is uninsured. And I think typically you're looking at someone younger, under 35, male, and Latino. And there's a whole bunch of different reasons for that. I think since the Affordable Care Act came into play, not only Massachusetts but every state has been working really hard to reach those young invincibles. And those are younger
They're
people.
invincible.
Yeah, right.
They're not going to get hurt.
I'm not going to get hurt. I can jump off this building and everything's going to be fine. If they're lucky, they would go to the doctor once a year, for their physical. Most of them don't even want to do that. So it's hard to convince them, hey, you need this. But then, we talk to people all the time. We talk to a rugby player. I mean, this guy was massive, but he got hurt. He broke his leg playing rugby. He needed help.
Not help
He did, but he had just gotten it a month before.
Oh, so
yeah.
it didn't cover it?
No, it covered it. No, he had just gotten it. So it's kind of lesson learned, right? And we hear those stories all the time. Obviously we don't want people to get sick or injured, but it happens. We live in the world. Things are going to happen, and we want people to have that access to care when they need it.
Now, what if you're going through so to sign up on the Health Connector, it's the website, right? So
Yes.
mahealthconnector.org.
That's correct.
And so you go on this website. Now, what if you are going through the website and you just don't understand it?
Yep, that's going to happen. Getting through the application can be a little complicated. We ask for a lot of information. We need to know information about you and everybody you're living with. If you're immigrants, we need some information about your green card or your citizenship status. We need income information. So there's a lot, and it can be difficult. We kind of ask some things in different ways because, like I said, we have this integrated eligibility model where you're going to find out at the end if you're going to Mass Health or if you're going to the Health Connector. And we look at that information in somewhat different ways. So there's a lot of help available. You can pick up the phone and call us, 877-MA-ENROLL. There are also people locally who can sit down with you, walk you through the application, bring them your paperwork. They know the system in and out. They can guide you through it, and they can help you pick a plan. Up at Burbank, we have assisters. Over at Health Alliance in Leominster, we have assisters. And we have navigators in Worcester at the Family Health Center and the EMK Health Center. And you can make an appointment with those people.
So right here in Fitchburg and Leominster, there are physical locations that if you this is too overwhelming for you, or maybe you're not really good with the computer, that you can bring your information there and they can help you set you up with health insurance.
Yes, Burbank, Health Alliance.
Is that at the CHC?
Yes, at the CHC, the Leominster Community Health Center, Health Alliance, Haywood and Gardner also. They all have assisters who can help you. You can call, make an appointment, or you can just walk in.
And so the open enrollment is from November 1st until?
January 23rd.
And that is for all people, if you're looking for any insurance at all?
Yes, if you need health insurance, that's the time to sign up.
Now, what if it's February 1st and you're like, oh no?
So if you qualify for Connector Care, or you're just moving into the state, you're going to be able to get in.
What's Connector Care?
So that's the subsidized program.
Okay. If you need assistance.
Yep. Yeah. If you qualify for financial assistance and the Connector Care program, you can get in at any time. But we would prefer people start the new year. We talk a lot about, hey, start the new year with health insurance. Get it done, wrap it up, and hopefully they get
it done before December.
Yeah. Even better, because those assisters get very busy in December. Our busiest week of the year is the week leading up to December 23rd, because not only do we have a lot of new people coming in to get ready for the new year because they've listened to us, but all of our members are renewing. A lot of our members, stay in the same plan. They don't move around, but they may have questions. They may want to switch plans. So yes, do it in November. Don't wait until December, or you're going to be at the back of a long line.
All right. Well, thank you so much. Jason Lefferts from the Massachusetts Health Connector. You can go to mahealthconnector.org to sign up for health insurance. Starting November 1st is the open enrollment period.
Yep, can't wait. Thank you.
Thanks.